Hi there, welcome to Chapter 5. This is Dr. Moyer. Tonight we'll be talking about children's sexuality, how to talk to your children about sex, some books for parents, expressions of sexuality among children, controlling children's exposure to sex in the media, and then family affection and sexuality. So from birth, children are actually sexual creatures. They're not typically thought of that way because they are infants, toddlers, children, but that is actually the case. And babies start learning about love, pleasure, and relationships right from birth. So it is important for parents to be very comfortable with their sexuality if they want to raise children that are comfortable with their own sexuality. So parents who are comfortable with themselves are more likely to perceive their children's sexuality in its widest and most positive dimension, where parents that are less secure can have a very negative view of the implications of sexual development in children, and they can pass that view down to them, and that would affect the child's sexuality throughout their life. Some problems when dealing with children's sexual development can arise from 4 different sources. 1, parents might be uncomfortable being confronted with their own feelings that they experienced during their own puberty, so they may not want to have to revisit that. 2, they may hold religious or societal beliefs that prohibit sexual expression. 3, they might fear that they'll lose control of their children if they talk about sex with them. And then 4, they might have their own sexual inhibitions, anxieties, and dysfunctions that actually can be traced back to their own parents' response to their budding sexuality. So any one of those can cause an issue for parents when they're trying to raise healthy children. So how do you talk to your kids about sex, particularly if you are uncomfortable? As I indicated, one of the sources of discomfort can come from parents' fear that if they talk to their children about sex, they're encouraging them to go out and have sex. I want to let you know that the research does not support that belief, that actually the research shows when parents talk to their children about sex and children feel comfortable talking to their parents about sex, that the children delay sexual intercourse, so they don't have intercourse as early as kids whose parents don't talk to them about sex. And if they do engage in intercourse, they use protection, and they're more likely to use protection and engage in safe intercourse or safe sex. So that's a fear that should be dispelled for parents. And as far as having their own sexual inhibitions, anxieties, and dysfunctions, it'll be important for parents to explore those and figure the source of them, perhaps even with a therapist, so that they don't pass these down to their own children. So back to, how do you talk to your kids about sex? Well, research shows that if you start early, then you're more comfortable with it over the course of your child's lifetime. So even very early on, it's important to be comfortable with the idea of sex and sexuality. Children sense when parents are not, or anyone actually is not comfortable. They pick up on the vibe, and it makes them question and wonder. And sometimes they'll even internalize those feelings as though it's bad, or they get the message, you don't talk about that. So how do you do that? Well, you start initiating conversations with your children. You start with them with body parts, labeling the body parts appropriately with the correct terminology. And so letting children know, boys, that they have penises, girls, that they have vaginas, and make it comfortable for them so they don't feel weird talking about their body parts. Also, answer any questions they have, particularly about sex. Don't avoid it. Just listen to what they're asking you and answer that specific question. Because it may just be, Mommy, why is your belly so big, if you happen to be pregnant? And the answer just may be, I have a baby growing inside me. And that could be enough. Child may walk away and say, that's fine. It doesn't necessarily mean you have to sit the child down and have the birds and the bees conversation right then. Listen to what they're asking and keep it simple. And then depending upon the maturity level, conversations can get more mature as the child matures. Around 7 or 8, they're actually ready for more explicit information about intercourse and the facts of life, including puberty. It's important to remember the last time that the last PowerPoint I discussed, I said that girls can start menstruation as early as 8 years old. So if you don't have a conversation and your daughter starts menstruating, it can be very confusing. And you can't oftentimes wait for the schools to do it because they might be too late. Better to have the information come from you and have it be accurate than to risk them learning about it somewhere else. Another way to be conducive to talking to kids about sex is to create an open environment about everything. Don't avoid any topics. Don't change the topic. If a child has a question, answer it. Listen carefully. Be honest in your responses. And be patient with the child. Sometimes they need to think about what they want to say. This doesn't mean that you have to discard your values. Communicate your values to your child. Let them know that you're expecting them to put off having intercourse until they're in a long-term committed relationship or even marriage. Let them know what your values are. Just communicate that to them so they're clear. Use everyday opportunities to talk. Just throw it in there. If you happen to be in the grocery store and a child has a question about where babies come from, then you may have to just answer that in the grocery store. It may seem weird and uncomfortable, but the more comfortable you are, the more comfortable other people are. So talk about it again and again and again. Don't be afraid. There are all these books that can actually help parents talk to their children about sex. So at the very least, if you're really uncomfortable, you can always get a book and read to your child about it. You can leave a book around for your child to read and indicate to them to ask you if they have questions. But really the most effective way is to go through the book with the child. So Where Did I Come From by Male is actually one of the best books to talk to children about sex, to have that early conversation. So you're not alone. There are resources out there. Okay, so how do children start expressing sexuality? Well, the older the child, the more specific the form of sexual expression. So as infants, as very young babies, ages 6 to 12 months, infants notice that when anything brushes up against their genitals, it feels good. And so they may notice when they rub up against the crib or the blanket, or even their diapers and clothing, or even parents when they're changing their diaper. They may find it pleasurable to have their genitals touched. And then and it just doesn't mean that it's a sexual thing. It's about learning what feels good when they're touched. Just like being rocked feels good, being given a kiss and a hug and told that you're special and we love you. It's not a sexual thing. It's more about the self-exploration and discovering body parts. Eventually, infants start to realize that they can touch their own genitals and that it feels good. And you may see children do this a lot. Really young children sometimes just hold themselves and parents will say, "Do you need to go to the bathroom?" Sometimes they're just touching themselves. And it's okay. It's completely normal. This is masturbation. I'm reluctant to even call it masturbation because as they get older, it becomes masturbation. But as children and as babies and toddlers, it's really more about discovering your body. So what's critical for parents is not to shame or tell the child that they're bad, but rather to indicate to them where it's appropriate to touch their genitals, that it's their body and they have the choice about touching themselves and anyone else touching them. This is also a good opportunity to talk about secret touching, which we'll get into later on this semester, but basically refers to an adult or an adolescent touches a child and tells them to keep it a secret. And so it's okay. Give the message that it's okay, but that it's better to do it when they're alone, either in the bathroom or in the bedroom. And so children learn that it's appropriate and okay, and where to do so. Don't make a big deal or a fuss if you find children doing this during nap time or bedtime, because you've indicated to them that's the appropriate time to do it. They do enjoy touching their genitals, and oftentimes they're doing it to comfort themselves. So it's really a form of stress release for them. So if you find that your child is playing with their genitals in public, first you can indicate, as I said earlier, that it's private, that it's limited to when they're in the bathroom or bedroom. You can try to distract them into another activity. You can, once they're a little bit older, you can send them to their room if you're home and let them know that that's where they would do so. That's just a private act that they need to do when they're alone. And then increase the amount of hugging and cuddling and affection that you give your child, because it may be that they're trying to soothe themselves or give themselves comfort. And you can even try to give them a security object that helps them to find comfort. The times that you should become concerned is if a child suddenly starts masturbating all the time, or touching themselves all the time, or if they seem to have an understanding of the act and what they're doing, or if they try to simulate intercourse with another child, or penetration in any form. So it'll be important for parents to talk to children about how penetration is not appropriate as they get older. And if any of these things start happening, you want to consult with a professional and get at the core or at the cause of the frequency. Why is the touching becoming more frequent? Okay, so I said all this. Skip this slide. Let's move on to sex play. So another very normal behavior, besides touching genitals, is when children between the ages anywhere from 4 to 7 may engage in sex play with another child of either the same or the opposite gender. And although we have names for this, playing doctor, show me yours and I'll show you mine, really it's about children just being curious about one another and their own bodies and wanting to see somebody else's, particularly if they don't have any siblings. And so it may just be the case that your children just show each other their genitals, or they watch each other urinate. They're really just trying to learn. And that's what the parent needs to remember if they come upon them, or the caregiver. And so if this does happen, it would be important to have a conversation with the child about what they learned, and if they have any more questions, and that they can come to you with questions, and that it's okay to be curious. Again, the caveat is if it's anything exploitive, intrusive, or painful is going on, it can sometimes, not always, but it can signify abuse, and parents or caregivers should most definitely seek professional help in this case. As far as kids and erotic materials, before we move on to the next slide, I just want to point out again that children are very curious, and if they aren't getting the answers from you, they're going to look somewhere else. They're either going to get them from their peers, they're going to get them from magazines, books, videos, TV, internet, etc. And I'm certain that nobody wants their child to learn about sexuality through erotic material, which does not give an accurate portrayal of intercourse or expectations, and does not even talk about the relationship aspect. And so, if you're looking to limit or control your kids' exposure to sex in the media, these are some suggestions for things that you can do. Most of the time now on both computers and televisions, you can block any channels you don't want your children exposed to. You can limit TV and use it as a privilege or a reward, limiting the types of programs they can watch. You want to be careful with your own habits and what you're watching on TV. You want to make sure that you explain your TV policy to not only your child's caregiver, but also any childhood friends they're spending time with. They have to go spend the, or if they're wanting to go spend the night, it'll be important to talk to Tommy or Melissa's mother about what your TV policy is and see what their TV policy is and if you're okay and comfortable with that. Be also wary of letting your child play with older children because they may have different types of TV privileges due to their age, and you want to make sure that your child, again, is protected and that they're not able to watch R-rated movies over the next door neighbor who's 3 years older. When it comes to family affection and childhood sexuality, the important message here is for parents to remember, all adults actually, is that adults model sexuality, love, affection, and caring for one another, and children learn from their family of origin about relationships. It's their first place they learn. And so families that are open with affection, let their children know they love them, are comfortable giving hugs, kisses, cuddling or snuggling, those children grow up into adults that are very open and comfortable with giving affection. In households where parents are not comfortable doing that or don't do that, or even where it's discouraged, then it's likely those children, that's a learned behavior, and those children have learned you don't do that. And it's difficult for them as an adult to express their love and affection. But it can be unlearned as well. The more that adults practice that behavior, the more comfortable they become with it, and they are more likely to engage in love and affection in their own intimate relationships as well as with their children. When we think about family, I want to point out that family structure is not an issue. Children can thrive in any type of structure. It doesn't matter who the mommy, who the daddy, who's raising them. Is it grandparents? Is it step families? Is it foster families? That's not the issue. The issue is the type of love, affection, and caring that occurs within that family. That's what's important. Not only are parents modeling to children the relationship with their children, but they're also modeling for their children types of relationships they have with other adults. And so if the child is in a two-parent home where the two parents are in a relationship, they're observing that relationship and they're learning about relationships by watching the two parents. If it's a single parent that is dating, then children are learning about dating and relationships by watching that parent. Just remember that what they learn about close relationships, they first learn from their parents or caregivers. So you want to be careful about that. You want to set boundaries and let them know so they don't walk in on parents engaging in intercourse. But if that was to happen, you would just simply have a conversation with the child about that, what they saw and how you prefer that they don't do that. Asking them, of course, if they have any questions. Excuse me. It's also important to point out that gay and lesbian parents or even bisexual parents, the research doesn't show that, or the research supports the idea that gay, lesbian, and bisexual parents are absolutely fine for children. You don't inherit gay, and as far as the children having issues with their own sexuality, that's a myth. Children that are raised by same-sex parents are just as likely, if not more likely, to have high self-esteem, to explore their sexuality, and to be comfortable with their sexual identity compared to children raised in heterosexual homes. And so there is no research to support that it's bad for children to be raised by same-sex parents. The issue, again, is that they're seeing a loving relationship and understanding that there are different kinds of relationships, but that ultimately what's important is love, caring, and affection. So that concludes the PowerPoint on childhood sexuality. The next chapter will be looking at adult sexuality. Thank you.